may not be the problem. As it currently stands, the bill dead on arrival in the Senate. I'm joined now by Republican Senator from Ohio, Rob Portman. Senator, thank you for joining us. Can't you just go over there and knock some of these House GOP members' heads together and say, come on, get on the same page? We are getting down to the wire. It's probably going to come down to the wire. Can the House get this thing done?
Actually, I think they can. I mean, I think there's an overwhelming sense among Republicans that the status quo is not acceptable and it needs to be replaced. But obviously the question is how, and I think the House ultimately will probably get the votes. Then it comes over here to the Senate. There'll be some changes made in the Senate. Already there's discussion of taking some of the House provisions that were met as a placeholder and filling those out further, particularly to help those who are currently getting a tax credit who are between 50 and 64, but maybe not an adequate one. And some of the House funding that they have put in the bill could be used for that. A concern I have is on this issue of the heroin, prescription drug, fentanyl, the opioid issue. It turns out that those folks who are on expanded Medicaid, and for that matter traditional Medicaid, their substance abuse treatment is currently being paid under Medicaid and expanded Medicaid to an extent, frankly, that is very concerning if it's not handled right. So I think there are ways to get there, and I'm ultimately optimistic we will get there, but it may take a little while.
Well, as always, the devil is in the details, Senator, but do you think the GOP, the Freedom Caucus on the House side, I mean, is anyone in the GOP willing to just walk away from this whole thing and leave Obamacare in place?
Well, that would be a bad thing for people I represent in Ohio. We've seen our premium spike. We've gone up 91% in the individual market in the last 4 years. We've gone up 82% for small businesses, double-digit increases again for this next year. It's just not sustainable. And then, of course, you have the situation of the market not working, where you have insurance companies pulling out of these exchanges to the point that now, all of a sudden in Ohio, a third of our counties have only one insurer, which is not choice or competition. So I think that something has to be done. And by the way, if Hillary Clinton had been elected as president and a Democrat Senate had been elected, we'd be facing the same problems. It's collapsing of its own weight, and so there have to be reforms.
You're the Senate Finance Committee member. You're a former director of the OMB. Senator, I want a tax cut, and I want it now. I'm just going to leave it there. No, but so many people say that. Should we have not done tax cuts first and then deal with the quagmire that is Obamacare and its replacement after the tax cuts, or is that just 20/20 hindsight?
Actually, I think it's more 20/20. Tax reform is also necessary, also challenging, because there are winners and losers in any tax reform. But what a great opportunity. I mean, our code is in such bad shape that anything we do to try to make it more efficient, to take away some of the disincentives to invest and save and create jobs, will be very helpful to the economy. So I'm excited about that. I think we have an opportunity to deal with the current structure where we're sending jobs and investment overseas and instead make the United States a magnet for more investment and jobs here. And I think we can simplify the code in ways that everybody benefits from. And the only people who might not like it are the tax lawyers. But other than that, getting compliance costs down is a good thing. So the tax code is full of great potential for reform, and we have to do that. That probably will be done after health care, so it probably is a late spring, summer project, maybe into the fall. But this is something that will really give the economy a shot in the arm.
Could the health care battle trip that up?
Well, I don't think so. I think health care is going to be resolved one way or the other here in the next few weeks, and we'll see how it goes. I think ultimately we'll get to a solution. I hope we get to one that actually ensures that we have a result that's more sustainable over time, that gets the rates down, but also ensures we're not leaving people behind. We're not pulling the rug out from under people who need this care, particularly, again, with this crisis we have with the opioids around the country. My home state of Ohio has been hit particularly hard there. And we rely on expanded Medicaid in particular for that treatment. So there are ways to be sure that that can be fixed. It's not really, in my view, part of the core of Obamacare. The core of Obamacare is the mandates, the regulations, the new taxes. All of that can be dealt with here in the next few days.
All right. Well, let's get this health care thing done. And I want tax cuts, tax cuts, tax cuts. Going to hold you to it. Senator Rob Portman.
Got it, actually. All right.
You got the message. Thanks so much for joining us.